world marks World Blood Donor Day. Access to safe blood for transfusion, especially in cases of emergency obstetric care, remains a major challenge for low and middle income countries such as Nigeria. According to the World Health Organization, severe bleeding during pregnancy, delivery, and even after childbirth is the single biggest cause of maternal death and can kill a healthy woman within 2 hours if not attended. Therefore, urgent access to safe blood for transfusion is critical to saving the lives of these women. Today on Dateline Nigeria, we take a look at the Nigerian situation and how the nation is moving to achieve universal access to safe blood and blood products. My name is Okamechi Somto, and this is Dateline Nigeria. It's Dateline Nigeria once again, and my guest on the show today is Dr. Oluwatoyin Smith. She is the National Coordinator for the National Blood Transfusion Service, NBTS, here in Abuja. Madam, you're welcome to Dateline Nigeria.
Thank you very much.
We're looking at World Blood Donor Day for 2014 with the theme, Save Blood for Saving Mothers. Now, let's look at the Nigerian situation. What is the story? How can you assess the rate of coverage in Nigeria?
Well, I don't have accurate figures as I sit here before you, but I can say that the National Blood Transfusion Service had been established about 7 to 8 years ago, and its main mandate is to ensure the availability of adequate quantities of safe blood for all those who need it in Nigeria. And we have made remarkable milestones ever since the setting up of this service. Last year, we made available about 55,000 units of safe blood for all those who need them in Nigeria. This we have done through our centers. We have a center here in Abuja, but we have 6 zonal centers in Ibadan, Owerri, Maiduguri. We have in Kaduna, we have in Jos, and we have in Benin. We also have 10 state centers spread across the nation. And through these centers, we recruit voluntary, non-remunerated blood donors. That is, people come to donate without incentive. They come to do it on their own free will, and the main purpose is to save a life, someone who they don't even know. And we do this by going out to recruit these donors in various places, institutions, out-of-state campsites, and schools, because our youth form the major, they are main donors, so to speak. What we do at the NBTS is to screen blood for the 4 blood-borne infections, and they include hepatitis B, HIV, hepatitis C, and syphilis. And we use a highly sensitive technology called the ELISA technology to do this. And so by ensuring that units of blood that we have screened are safe, hospitals out there come to access blood from us. And that is how we are able to reach the population out there, especially those who need, including our mothers and children, because, you know, they are the ones that usually need blood the most. This year's theme is focusing on our mothers. You know that postpartum hemorrhage, which is blood loss after the delivery of a child, constitutes about 24% of the maternal deaths in Nigeria. That is significant. So we want to ensure that our units of blood are available for use in hospitals where our mothers are delivering. and where our children who have, issues of anemia for whatever reason, chronic malaria, even for cancer patients, and to bring it home, even more recently, the bomb blasts, where, we had victims that needed blood to survive.
What is the progress so far? You've told me what you do and how you're going about it, but I know that I've visited hospitals and I've especially in cases of obstetric care, and I hear husbands being asked to come donate blood for their wives, that just in case anything happens during delivery, but so that there'll be blood handy. Does it mean that the hospitals still don't have enough to cater for the patients they have?
The hospitals have access because, just by what you have said, every hospital at its antenatal clinic always demands that any woman who comes to deliver must donate a pint of blood, either through her husband or any family relation. Sometimes it's just somebody who is ready to donate blood, even for a fee. And so they have the blood units there. But what I can tell you about the hospitals is that not all of them have the highly sensitive screening technology that we use here. So what we have tried to do is to establish a hospital linkage program whereby, through their antenatal, they give us units of blood that they have collected through this antenatal. They give them to us to screen in exchange for the same quantity of blood that we have screened.
Okay, you give them the ones you have.
We have screened.
Already screened.
Yes.
And take from them to screen.
They have to give us first, so we can now give them the same number of units that have been screened. And well, we started off in 2005, thereabouts, and our blood collection had a very slow rate of progress. Why? Because blood donation culture in Nigeria is steeped in deep cultural myths and misconceptions. And we've spent all our time and money from our funders and from the federal government on advocacy and doing exactly what I'm doing now, creating awareness, sensitizing the public on the need to donate, because you can't go and buy blood from the shelf. Somebody has to donate a unit of blood. So the effort, we put in a lot of effort to convince people that donation has to be regular, because it's the regular donor's blood that is safest. When you do the first time donation, there's a high incidence of infection. There could be. That blood could be infected. But somebody who donates routinely, men can donate every 3 months. Women can donate every 4 months. So people who do that tend to lead very healthy lifestyles. We try to encourage that culture. We try to sensitize them to do this so that we have an increase in number of regular donors. And we have attained that over the years. In fact, one of our centers in Jos has a very high indices of regular blood donors. This is where we're trying to get to. Because when we have regular donors that will satisfy Nigeria's blood needs, then we know that at any point in time, we will have blood available no matter what the incidence is. That woman that wants to go in for emergency surgery, as we have mentioned, obstetric, will have blood available. If hospitals work with us, it's an area of challenge. Not all the hospitals work with us in this endeavor, but if they do work with us as a matter of routine, we can begin to meet their needs and consequently make blood available in adequate quantities for those that need them in the hospitals.
The target, not just in Nigeria, globally, is for countries to attain self-sufficiency in terms of availability of safe blood for transfusion when needed. Are you saying now that you're confident Nigeria will get to this stage soon, or are we there already, or how can we get there?
We are not there already, but I'm confident that we will get there. How can we get there? A blood service should be operating centrally, in a centralized fashion. Screening is very expensive, particularly the technology that we are using here. And you don't have to have everybody screening, all hospitals or anywhere that they collect blood screening. You need to have screening centralized. In South Africa, I think they have 3 main screening centers. Right now, we have about 10. Most of them are grossly underutilized because they're not getting enough quantities of blood to even, churn out as many screened blood units, safe blood units that is required. We need to be backed by legislation, which is very important. That is also a prerequisite for any national blood service. It needs to be backed by legislation. It deserves the autonomy to be able to regulate blood transfusion practices in the country and to have dedicated funding to be able to go about its business. Screening is expensive, I've mentioned. Funds need to be available promptly and regularly. Why? Because you don't want to have harvested blood units and you cannot screen. There is a danger in that, because what happens is that blood has a very short shelf life of about 21 days on the average, after which you have to discard it. So when the blood units are collected, you must be able to screen immediately and make it available for use. That is expensive. Even preserving the blood units, they need to be kept at optimum temperatures all the time, and that means whether you have electricity supply or not.
Yes, like I was going to come to that, because cool. I know what the power issue is like in Nigeria. So how do you get around that?
We are on generators whenever we have system total blackouts, and whenever they take light, we have to put on our generators. That's another reason why funding needs to be dedicated, regular, and promptly given to the service. So we need supplies of blood bags because they're not reusable. So they have to be fresh blood bags supplied on time. All the blood banks have to be working wherever it is they are situated. And where we preserve the pilot samples, these are samples that could be used to test in the future if you have paternity disputes or if you have issues of infected blood. Somebody now decides that the blood unit I collected at the NBTS so center has infected me with HIV. We keep the pilot samples and they are kept in our archive freezers. So we just bring it out because they are labeled.
For every blood
unit collected. So we bring it out and we test again. So that way we absolve ourselves from any blame, as it were. So that has to be refrigerated at all times.
You mentioned regulation. What kind of regulation are you looking at here?
We have to regulate blood transfusion practices, how they collect their blood, even in the hospitals, where they preserve the blood units, because there is the right way. And our staff here have all been trained in doing that. The concept of blood transfusion is slightly different from the hospital-based, the facility-based practice. And we have to bring to bear how our business is with the blood units, to make sure that from vein to vein, from where we collect the blood from and from where the blood is going to, that's our business. So how it is collected, how it is preserved, how it is stored, who it is going into, that is our concern. And in the hospitals, it's not quite the same. They collect blood through their blood banks. They screen using the technology they have. Sometimes, like I said, it's not as sophisticated as ours. And it is grouped and cross-matched so that you don't go transfusing B blood into a person. And that's about it. All those other technicalities, we need to be able to regulate it, to go in there. This is not the right way. This is the right way. This is how you do it. How have you done it? Then the data, we need to obtain the data, because we're supposed to be reporting to the WHO global database on blood safety. And if we are right now, we only provide data for our national blood transfusion centers, the 17 centers I was talking about. We don't have data from nationwide, which does not actually, it's not a reflection of what is happening in Nigeria. It's one of our challenges. But once we are backed by legislation, we're able to regulate, we can go in, walk in, and we require your data, we can collect it, and there are no issues. And from there, we can, feed back the system with what is right. We can conduct research, operations research. We can improve the services. blood safety services nationwide. There's so much that can be done when you have data.
When you have data.
Yes.
Now, is there any move in place, or are there any plans to get these regulations?
Oh yes, we have the NBTS, as we call it, draft bill has been generated, developed. It's currently undergoing processing. The Honorable Minister of Health constituted a ministerial steering committee to develop this draft, and they've done that. They've completed their assignment. The draft bill has been forwarded by the Honorable Minister to the Ministry of Justice, to the legal drafters. They put it in the right language, and the Honorable send it back to the ministry, and then the Honorable Minister can present it to the Federal Executive Council. From there, it will go to the National Assembly and then commence the cycle of its enactment into law.
Well, we hope that, understanding the importance of that bill, when it gets to the House, it will be speedily passed. Yeah. Okay, now, I know that according to the World Health Organization, the call on countries is mostly to get voluntary unpaid blood donors. That you also said here today that that the safest blood comes from regular voluntary donors. So what is the situation in Nigeria? What is limiting, or what is hindering us from getting this the number of blood donors we need to have? And then why are people not coming out to donate freely? Is it because they really want incentives?
For some people, there's no parting with my blood if I don't get anything for it. They just don't understand that concept. For others, it's just plain ignorance. They have no idea. There are women who don't know that women can donate blood, because it's an assumption that your monthly cycle is a challenge. Yes, it takes out blood. Why should I donate?
Give more again.
Why should I? You want to kill me? Then the culture is another thing. Like I mentioned before, we have deep-rooted beliefs, misconception on blood donation. If I donate my blood, it should go into my relation's body, not who is this person? Yes, not it. So the blood I'm donating now must go into. You want me to donate for my sister? That blood must go in there, and that doesn't follow. We are at it, trying to educate the listening public through the radio. We carry out syndicated radio programs on a weekly basis. So we are on the radio, even through our various centers. We have radio stations that work with them, and we keep enlightening the public that blood donation, yes, you donate freely, but when you want to access it, you must, we charge an access fee of about 2,000 naira, which is highly subsidized, because we have to preserve the blood. The blood bags have to be new and all that. But what is important is that we can't buy it off the shelf. It has to come from somebody. And you don't want to wait until your own family member is at death's door that you start running around looking for blood. That shouldn't be the case. The blood has to be available for use when whoever it is on the operating table. When that bomb blast has gone off, the blood has to be available for those victims who turn up in hospital. When someone is dying of cancer and needs several units of blood for several months, those blood units have to be there. When that woman is at the death's door, bleeding excessively from hemorrhage after childbirth, the blood has to be there. Because sometimes you can be pumping the blood in, you need fresh blood. For somebody who has, they call it a DIC, she's just bleeding because the blood won't clot. So it's fresh blood that can stop it, and you need pints of it. So that's the reason why blood. So when we try and bring the story home, then some people will start converting. That's what happens. And then of course, there are stories. People will tell you, I never used to believe in it, but the day my wife delivered twins and we had to look for blood, and that, I appreciate you people. And then they come and donate and call others to donate. The last Abuja bomb blast is a typical example. You know, we had one about 2 years ago, the UN building, and we had to call out for people to come to donate. But this time, it didn't take time. People started coming. They walked into the center, and we had about, for 3-4 days, we had about over 100 people coming to donate on a daily basis. That is the culture we are trying to. Before then, maybe you would have about 20 something a day.
Okay.
And on some days you won't even have anybody.
So it means we're getting there.
We're getting there. So there's progress. Last time the Nigerians really made me proud because they came. There was one woman, we couldn't get her vein, and she was saying, oh, try this one.
Try the other one.
Try this one. You know, they wanted to do something. And those who couldn't donate tried to give whatever they had to support. So we're getting there, but that's what it takes. Continued awareness creation, sensitization, educating.
Hopefully, sooner than later, we will achieve self-sufficiency in terms of availability of blood in Nigeria. Before we go, I also want to find out, maybe something I should have asked you at the beginning, what really is the blood requirement for this country?
Well, WHO stipulates that it should be about 1% of the population. And if we have a population of about 170 million right now, you are looking at 1.7 million. That is what our blood needs. But that shouldn't be a problem if we have the culture of donating. It shouldn't be a problem.
Can you place the rate of donations from voluntary persons somewhere? What is the percentage of?
Now, it's under 30%. That's just an estimate. My own very rough estimate. It's under 30%. But it's a lot better than it was.
Than it used to be.
Yes, than it used to be. Certainly, it is a lot better.
Okay. Thank you very much for all of that.
Thank you. Thank you too.
Away from safe blood now to another major health challenge in Nigeria, polio. Nigeria is one of just a few countries where children are still at risk of paralysis or death from polio. Government and aid organizations are working furiously to vaccinate as many children as possible, as well as devise programs to support survivors of this crippling disease. Recently, the Run for Polio campaign was in Abuja with the Smile Abuja project targeted at persons affected by polio and several other disabilities.
We've got something called the Smile Challenge. So we're getting good doers and people who are interested in supporting the children already affected by polio to do something to be able to raise awareness, to do something to gain sponsorship. And we're hoping in doing so that obviously those funds can go towards some of these materials that we've already spoken to the kids about, and they say that these are the things that they need.
The event brought together children from 2 rehabilitation centers in Abuja, orphans and members of the National Association of Polio Survivors. They highlight the plight of the physically challenged persons in Nigeria.
We don't consider people that have been affected by polio that they have problems in mobility. You will discover almost everywhere in this country is not disability friendly. So it's like we are exempted from the society because whatever we have, whatever talent we have, we find it difficult to be able to bring it out because of accessibility. So actually, in that perspective, I, without regret, say government, individuals, organizations have not done much as regards to alleviating the suffering of those affected by polio.
But we also use this medium to appeal to other well-meaning Nigerians to come up with programs that will help the nation eradicate polio and also look after the people that are polio survivors. Because after polio, to us, life begins from there, and we need to be encouraged, but not allow some of us, because of the poverty, to be on the street begging and all the rest.
We need more manpower. You know, for a child like this, it's a child to a teacher. But now you can see that we have more than enough students for a teacher, so it's not easy coping with them.
Some of the supporters expressed optimism that Nigeria will soon be rid of polio, as they called for increased acceptance of the polio vaccine.
With the eradication of polio, the main thing really still is awareness, raising awareness about the existence in some of the areas where it's still there. A lot of efforts are being made by the agencies that are involved at the moment, so it's really about supporting them, mobilizing the communities to come out, take up the vaccine, take up the immunization when it's been offered. And like I said, a lot has been done, a lot of progress has been made. I believe Nigeria can do it.
No matter what you're told that is against your religion or whatever, when you look at these children and the consequences of that inaction, you must take your kid to the clinic to immunize your child. That's all. Very simple. It doesn't cost any money.
The children were treated to a fun day at the park with games and dance competitions. The program has been Dateline Nigeria. Thank you for being there. Enjoy the rest of your day.